Hello dear friends, my name is Dr. Igor Atabekov. I'm clinical oncologist practicing since 2010. Today we are talking about a very important topic. These are phytoestrogens against endometrial cancer. They are estrogens of nature of plant origin. They have a similar structure. That's why they can act like weak estrogen in our body. Estrogens are female sex hormones. We know that sex hormones, they may affect their receptors in their breast tissue, for example, or in uterine tissue. That's why it will stimulate the cells, and possibly it can cause their cancer, increased risk of cancer. That's why we are afraid of too high estrogens. That's why we can be theoretically afraid of phytoestrogens. So we will talk about what is the role of estrogens in the endometrial cancer. I already told you. We will talk, is it safe to take estrogen or phytoestrogens during menopause? Can phytoestrogens help to prevent or treat uterine cancer, or it increases the risks, side effects and contraindications, and what foods contain phytoestrogens? So let's get started. This is uterus. It has a lining, epithelial lining inside. This lining is normally stimulated by estrogens in the first part of the cycle, menstrual cycle, and then the other hormone comes. It's a progesterone. It protects against cancer. It stabilizes this lining. This lining increases because it's preparing for pregnancy, and then progesterone comes. And it will keep it prepared and wait for fertilization. If it doesn't happen, then the progesterone drops, the estrogens will drop, and all this layer will slough out and go as menses. This stimulation by estrogens will increase the thickness of the lining, and where there is stimulation, there is a lot of cell division and a lot of possible mistakes, errors, and mutations. That's why the cancer may occur. The endometrial cancer is a uterine cancer, the same name. And many women in menopause, they take phytoestrogen supplements. Why? Because they are estrogens. In menopause, the levels of sex hormones drop, and they take phytoestrogens because they have some estrogenic activity. They will help with symptoms like, for example, hot flushes, moodiness, bone pains, osteoporosis, etc., vaginal dryness. But together with this, it can theoretically stimulate the thickness, increase the thickness, stimulate this lining, meaning it will increase the risk of cancer. Is it true? Let's figure it out. And really, look, phytoestrogens can affect estrogen receptors, and it will decrease the symptoms of menopause, like hot flushes, for example. And this effect is not very huge, and it's quite slow in onset. You have to take it for a long time. Also, it may improve bone density in osteoporosis, or increase the health of blood vessels. This is an interesting article where they show the types of receptors of estrogen in tumor cells in the endometrial cancer. You can see the classical receptors of estrogens, and there are also membrane receptors that are quite newly discovered. And activation of these receptors may cause other effects that are distinct from those when you activate the classical pathways that go into the nucleus of the cell. A few words about the safety. There is a randomized double-blind and placebo-controlled study, 224 postmenopausal women. Some of them were taking 154 milligrams of isoflavones of soy. It's milligrams of active substance, it's not grams of soy. And others were taking milk protein as a placebo. And they discovered that there was no increase in the thickness of lining, epithelial lining of the uterus. Meaning, you remember I told you, if you stimulate it, it will increase the thickness what's going on in their first part of their menstrual cycle. And where there is a stimulation, where there is increase in sickness, there is always increased risk of cancer. But there is no difference. They were taking it for 3 years. By the way, there was one case of endometrial cancer in placebo group who were taking milk, not soy. But this is not enough to do any conclusions because it's only one case, can be coincidence. This is meta-analysis. Meta-analysis is the most valuable type of study because they take a lot of studies, they throw out what are not good quality, where there is a high risk of bias, and they only pull together the information, the results of their good quality studies. And there are 10 studies in this meta-analysis analyzed. Dietary soy intake was inversely related and associated with risk of endometrial cancer, meaning who is taking soy with diet, they are in lower risk of developing this cancer. Next, one more meta-analysis, 13 studies, also higher dietary intake of soy isoflavones, of legumes, decreases the risk of endometrial cancer. That is weird, right? Because these are estrogens, they must stimulate their endometrium, they must increase risk of cancer. Why do we see the totally different, totally opposite effects? There is one more study about enterolactone. Enterolactone is produced by our gut flora from lignans. Lignans are phytoestrogens that are contained in many food contained. Their number one source is flaxseed. Very good thing, by the way, in my opinion, especially for women with breast cancer or breast cancer risk. By the way, watch the lecture about breast cancer and phytoestrogens on the same channel. I will leave the link below. Also, sesame seed is a good source of lignans. And what does this enterolactone do? There are 30 big studies, epidemiological, on real humans, on patients with different types of cancer. And most of them are in breast cancer, and we know that enterolactone can reduce the risk of breast cancer. It can help the cancer patients. First of all, it decreases the risk of breast cancer. It improves the outcomes in patients with breast cancer. It increased survival. It reduced the risk of recurrency. And also it decreased the indexes of proliferation in breast cancer cells. When you remove breast cancer, you watch under microscope, you see how actively it divides. The cells are dividing, how actively the tumor grows. And these indices were also decreased with intake of enterolactone. Next, it also proved benefits in breast cancer, endometrial cancer, prostate cancer, lung cancer, bladder, and colon cancer. There are some separate investigations that show there is no huge difference here, but in most investigations and most studies, they show that really these things are associated with decreased risks of those cancers. Next, genistein. It's a soy phytoestrogen, and here we see a very interesting fact. There are progesterone receptors. You remember, I told you progesterone is a protective hormone, protects against cancer, right? And this progesterone, it will work on endometrial cancer cells to inhibit it. But it depends on the receptors. Sometimes endometrial cancer cell produces no receptors, so decreases the number of receptors. Then these tumors are more aggressive. These patients have less chance to be healed, and they don't survive too long. That's why they found out that genistein can increase the number of these receptors, making the tumor less aggressive theoretically. That can be one of the mechanisms why phytoestrogens can help with endometrial cancer. By the way, the other mechanism, they can affect the stem cells of the cancer. I was talking in detail about it in my lecture on selenomycin, for example, or in my lecture on breast cancer and phytoestrogens. I will leave the link under this video in the description, because affecting and killing stem cells is their key action if you want to heal cancer. Because our conventional treatment, chemotherapy, radiation therapy, are not very effective in killing those cells. We need something extra. And phytoestrogen can actually affect these stem cells. Next, few words about adverse reactions. There are 3 cases published. Cases means it's quite rare. But one of my patients wrote in the comments that as soon as she takes the flaxseed oil, then she has some spotting. And she has endometrial hyperplasia, meaning that it will stimulate the hyperplasia and worsen it. And there are several cases. This is a woman with uterine fibroids, with leiomyoma. She is menopausal, and she was having their bleeding. And they found out that she was taking high amounts of soy milk, 40, I think, milligrams, they meant, of soy isoflavones every day. 40 milligrams of soy isoflavones is about 60 grams of soy for 3 years. And they found out that she has a polyp and proliferative endometrium, meaning it was stimulated. As soon as she discontinued her high amounts of soy intake, everything normalized. The other 2 women, they are reproductive. They both had some problems like uterine fibroids. This one had also endometriosis, and she was taking very large amount of soy and soy products for 5 years, and as soon as she stopped, everything normalized. Also here, too much bleeding, too much pain, and she had leiomyoma and fibroids, she had endometriosis. As soon as she stopped, everything normalized, and she got pregnant. Why is it like that? No, I think this is because they have already some problem below, and you see all of them had uterine fibroids. That's why I put it here into the into the contraindications, and possibly endometriosis may also be the reason here. Hyperplasia of endometrium, maybe yes, maybe no, because most of the studies show that no, it doesn't cause hyperplasia. You remember, I showed you at the beginning. Bleeding in menopause, no, we already talked about it, especially if the woman has uterine fibroids, and some disorders of gastrointestinal tract, abdominal pain, myalgia, drowsiness. Here I want you to remember that every remedy may be a poison if it's taken in too high doses, especially if you have polyps, if you have endometriosis or uterine fibroids. Don't take it in high doses. In all other cases, it's considered to be safe. You saw it already in all these investigations. Who benefits from phytoestrogen the most? Women in menopause or with low estrogens, and it may help with osteoporosis. But be sure your calcium levels are not low. Always check your calcium and vitamin D, because if the calcium levels are lower than normal, or on the lower border of reference, then you may actually worsen osteoporosis. There is one study that shows that. And it may actually help in breast cancer and endometrial cancer. It's not official recommendation. It's not officially super proved information, but that is what we see, and we have quite a lot of studies, even with meta-analysis. What are the other causes of bleeding after menopause? It can be atrophy because of low estrogens, or vagina of endometrium. They can be polyps, or they can be cancer. Any case of bleeding in menopause must lead to investigation by medical professional, by gynecologist. What food contains phytoestrogens? Most phytoestrogens are tofu, flax seeds, sesame seeds, soybeans, black beans. All the other things also contain phytoestrogens, but these are something that, by my opinion, should be included into their food. Again, don't eat too much. Everything must be in moderate doses. Now, this is not official recommendations. This is my opinion, based on what we already saw, based on the information I showed you. It's preferable to get phytoestrogens with food, not with supplements, not in capsules, To achieve effect, you need to take them quite long. The use of phytoestrogens reduce the risks of many cancers, including breast, lung, prostate, gut, uterus, and bladder. The use of phytoestrogens may be beneficial even in teenagers, because it will decrease the risk of breast cancer in future. Next, in my opinion, it's a good idea to take at least 50 milligrams of soy isoflavones per day. I was talking about it in the lecture about breast cancer and phytoestrogens. See the video by the link in the description below. 15 milligrams of soy isoflavones or more. It's about 20 grams of soy or equivalents per day. 20 grams, you understand. And 15 milligrams of active substance contained in 20 grams of soy. Next, in menopausal women or those women who have low estrogens, phytoestrogen may be especially beneficial for their symptoms or to protect their blood vessels, to decrease risk of cardiovascular problems, or to help with osteoporosis. Yes, you will say that soy is all genetically modified now, but there is no real proof of harmful effect of GMO on our health. Also, you can get, if you don't want soy, you can get it from, for example, flaxseed. Dear friends, I hope it was interesting for you. Thanks for your views, for your comments. Share, please, if you have any experience taking phytoestrogens or consuming food with phytoestrogens. I wish you good luck. God bless you. Bye-bye.